Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Louis St. George.
Today on Medical Insight, Essentia Health cardiologist Jason Schultz explains transcatheter aortic valve replacement, which fixes the aortic valve without the need for open heart surgery.
So the traditional way of fixing heart valves is the surgeons go in and take the old valves out and put new ones in. TAVR stands for Transcatheter Aortic Valve Replacement, so essentially just using catheters and oftentimes balloons to replace the aortic valve without the need to open up the chest. We talk a lot about TAVR because it's probably the most common thing that people perform, but we really see ourselves here at Essentia as a comprehensive valve program. If your valve is leaky, if your valve is sticky, if you have holes where they shouldn't be, there is a 99.9% chance that we can treat that here at Essentia for you. We started doing this in 2013, back when TAVR was a relatively new thing, and we performed almost 450 of these procedures now and have really been delighted at how the program's grown. There's a lot of things that we've seen that we know exactly how to react to now.
Most patients who need their aortic valve replaced are candidates for TAVR, which is a less taxing alternative to open heart surgery.
In traditional surgery, someone's going to be in the hospital for 5 to 7 days and may find that it's difficult to recover for a couple of months. And with transcatheter approaches and TAVR, it's usually 1 day in the hospital, and within a week, you're kind of back up on your feet. I think that the TAVR program has really served as a springboard for really a comprehensive valve center and structural heart disease program. At Essentia, we've taken a lot of pride in not only performing a lot of these, but doing it with exceptionally high quality.
For Medical Insight, I'm Louis St. George.
To learn more about this and other health topics, visit essentiahealth.org/medicalinsight.